Hello, my name is Amy and today we are going to be talking about Dorothy Johnson's nursing theory, but first let's go back in time. The year is 420 BC and a man named Hippocrates had this great idea that the human body is filled with 4 vital fluids. He believed that good health was the proper balance of blood, phlegm, black bile and yellow bile. An imbalance in one of these fluids led to illness, and pain was the body's way of expressing its desire to regain harmonious equilibrium. Now skipping forward to 1965, a lady named Dorothy Johnson was on a committee developing definitions for clinical specialist roles. This is where she began thinking about what nurses could and should be. 3 years later, she published an influential paper that introduced the idea that nurses could see patients as a series of behavioural subsystems. Just like Hippocrates believed that the proper balance of fluids within the body was the key to good health, Dorothy proposed that wellness was achieved when there was proper balance of 7 key behavioural components. Complementary to the doctor's goals of achieving health through the balance of the biological system, she believed that nurses should focus specifically on the behavioural. Dorothy was the perfect person to create such a holistic theory because her education and career consistently showed her the relationship between behaviour and health. Before her time on the committee, she was experienced on the front line as a practicing nurse, as well as having a long career in teaching. Later, the Great Depression led her into research roles too, where she began developing her theories. Dorothy's behavioural theory of nursing says that humans can be categorised into the following 7 subsystems: the attachment or affiliative, dependency, eliminative, sexual, ingestive, aggressive, and achievement subsystem. Each subsystem is different in how it operates, but all of them require the same 3 things to achieve balance. These 3 things are called the functional requirements. These are 1. Protection from noxious influences, 2. Provision of a nurturing environment, and 3. To stimulate growth. If all these things are provided, then a nurse can expect that the target subsystem will maintain or return to its natural parameters. Protection from noxious influences means eliminating the impacts of negative stimuli. In the achievement subsystem, for example, this would be removing unsupportive parents that are affecting the ability to set and achieve goals. In the dependency subsystem, protection from a coercive pregnancy of a vulnerable partner can be provided by adequate birth control. Provision of a nurturing environment means to give positive influences that allow the system to flourish. An example of this for the ingestive system would be to maintain a healthy eating schedule with a reward system to keep on track. To give another example, provision of a nurturing environment in the achievement subsystem would be to have parents that encourage their children to reach their goals. To stimulate growth means to place adequate demand on each subsystem so it can avoid stagnation from underuse and maintain its intended performance. For example, stimulation of the aggressive subsystem would be to practice anger management to respond to a threatening situation reasonably. Stimulation of the sexual subsystem would be to regularly engage in intercourse. The main weakness to all of this lies in our current level of scientific understanding. The complexities of human behaviour and the interrelationships of the subsystems mean that affecting one can affect another in complex ways we still don't quite understand. Another drawback is that the theory is limited to a singular patient and cannot be applied to families, groups, or populations. While those weaknesses are valid and should be improved upon, what's really great about this theory is that it can be generalized for all humans across different lifespans and cultures within all nursing settings. By providing a framework for nurses to operate effectively within their sphere of influence, it elevates the role of nursing in general to a point at which it hadn't been before. You see, historically, nursing was considered a task-oriented job that focused only on the biological avenues to good health determined and ordered by the doctors. Now, doctors will focus on the biological needs of the patient, while nursing has been legitimised as its own discipline by creating a specialised focus on returning balance to the behavioural subsystem. Because the theory allows for nursing to be distinguished enough to have its own fundamental principles, it has helped to continually further the knowledge and research of nursing and indicates the direction in which nursing should develop in the future. Additionally, it has provided the nurse a sense of identity and understanding of the unique contribution provided by nurses in the healthcare industry. In healthcare settings today, a nurse will make a nursing diagnosis and create a care plan based on their observation of the patient's behavioural subsystems and will work to bring them back into balance. A doctor can diagnose two people with the same disease, but a nurse can give those same people different diagnoses, depending on the stress tolerances and flexibility of those subsystems. Imagine two patients with type 2 diabetes. For the first patient, they can and do enjoy cooking their own food, are generally fit and of a healthy weight. This means that the relevant behavioural subsystems, achievement, dependency, and ingestive, are within normal parameters, and therefore the nurse needs to apply limited intervention to manage the illness. The only intervention that the nurse really needs to offer at this point in time is to the dependency subsystem in providing the patient awareness of the disease and its implications so that the patient can manage it independently. And this is because, to reiterate, the subsystems have been provided with their three functional requirements. But for the other patient, they are overweight, they eat poorly, and they rely on their family members for completing tasks around the house. Though the same subsystems apply, it's clear that for this patient, they are way out of balance for managing this illness. The nurse must provide education, empowerment, and medical intervention for the care plan based on the nursing diagnosis. The fact that multiple people can be diagnosed with the same illness and have different nursing diagnoses shows that the nursing process is very complex and requires skill to individualise care to each patient. Designing interventions to reach equilibrium by providing the three functional requirements has been influential to nursing theory and practice ever since its proposal. Dorothy was a true theorist whose work was able to elevate the nursing field to its highly respected status today, and can only go forward in its developments. Nurses and society, I'm sure, are extremely grateful for her contributions. I know I am, and I cannot wait to be a nurse. Thank you, Dorothy.